Hi, I'm Chris Salvino. I'm a trauma surgeon with 30 years of experience, and I'm the CEO of SharpMed. Rarely does a device come along that changes how we think about airway management. Today, I want to ask you a simple question. If you could see oxygen, would you intubate differently? Arguably, the last major change in endotracheal tube design was in the 1970s. Yet the biggest unsolved issue remains hypoxia during difficult intubations. First pass failure rates are not insignificant, an average of 16% in the ER, 20% in the ICU, and up to 31% in the field. Isn't it time to ask if there's a better way? So this is the Turbo O2 cap. It connects directly to any ET tube from 5.5 to 9.0, and it focuses oxygen in front of the vocal cords. It's simple, safe, and effective. It basically takes a static ET tube and turns it into a high flow oxygen tube. Of course, oxygen is invisible, but if you could see it, would you change your intubation technique? The setup on the screen is the Turbo O2 cap sitting on top of an ET tube and oxygen tubing hooked up to the turbo. What you're about to see is simulated oxygen using safe theater smoke going down the ET tube. Again, imagine what this would be like to have oxygen flowing down the ET tube in the back of the throat. To drive home the point, this is a mannequin, and this is what 100% oxygen delivery looks like if you can actually see oxygen in front of the vocal cords. Imagine if you had this when you go to intubate your human patients. The results in a preclinical animal model of difficult intubation is mind-blowing and exceptional. In this particular model, it simulates a difficult intubation. This is the setup. The animals were sedated, then they were chemically paralyzed. The jaw was held up with a laryngoscope, and an ET tube is placed in the back of the throat, simulating a difficult intubation. Now in the controls, as predicted, their SATs dropped below 75% in under a minute, as you can see in the red line in this graph. What was unbelievable was that the animals that had Turbo O2 cap on top of the ET tube with 15 liters of oxygen bathing the back of the throat, their SATs went up to greater than 97% and stayed there for 16 minutes. These results are exceptional. Now think about the future. The standard ET tube is static, but the Turbo O2 cap transforms it into a high flow oxygen ET tube. Turbo delivers oxygen where it's mattered most. See the difference, change the outcome. For more information, visit sharpmed.com or contact us directly. Thank you.